A father was just chipping a nail, हथौड़ी से वो nail को ऐसा मार रहा था.
अच्छा.
And उसका metal का टुकड़ा उड़ के neck पे गया, बच्चे के. And then the father tried compressing it and the blood stopped. He was around 10-12 years. CT showed some metal in the brain. Shocking how the metal entered from here and went up to the brain, and how we tackled it. And touch wood, the patient is good. He still sends his greeting every year. There are silent strokes also. You know about silent strokes. Many times silent strokes are people come late because no, it could be just fatigue.
Aspirin during stroke or wait for doctor?
Wait for doctor. There could be different types of strokes.
A mini stroke, which is TIA, is a major warning.
Yes.
Women are more likely to die of a stroke than men. Please say it's a myth. Please say it's a myth.
No, it's a fact. Men get it early though,
Achha.
because of smoking and all, but they are
mortality rate is higher. 1 in 4 stroke survivors will have another stroke.
Fact, and very important fact, this we used to even American Stroke Association uses this.
Genetics or lifestyle, which plays a bigger role in stroke today?
It's getting more and more complicated and tricky.
Genetics or lifestyle?
Lifestyle.
It happens in seconds. Your words tangle, limbs go numb, and world turns upside down. A stroke never knocks politely. It comes crashing without a warning sign, stealing movements, memories, speech, and at sometimes life itself. With millions of lives being affected by stroke every year, there's still a very little known about the warning signs of stroke. Today, we open the door to the stories of survival, healing, recovery, and hope. This podcast or conversation is just not about stroke, it's a call to action. And today we have with us a deeply compassionate neurologist who has dedicated his entire life with only one motto: to restore hope and healing in those who are suffering from neurological conditions. Dr. Sadique Pathan, armed with an MBBS, MD, and DNB in neurology, he brings not just knowledge but the heart into diagnosis and care of various neurological conditions like stroke, epilepsy, and so on movement disorder. His patients often find in him not only a skilled doctor but a steady guide, guiding them through one of the toughest times in their lives. As a member of prestigious Global Neurological Society, Dr. Pathan blends cutting-edge science with deeply human touch, making each patient feel seen, heard, and cared for. Hello and welcome to another episode of Sahyadri Health Talks. I'm Dr. Tushita, and today we have with us Dr. Sadique Pathan. So, how are you?
I'm fine, Tushita. Thanks for having me on your podcast.
It's really nice to have you today on the podcast, and you already know about the topic which we have picked up.
Yes.
And strokes so frequently seen,
Yeah.
but still so little awareness about it.
Definitely.
So we'll talk about it. But
Yeah.
before that, just wanted to know, you have dedicated all your life for neurology. So how has this journey been for you?
Oh, first of all, I would like you. Thanks a lot, Tushita. You persuaded this media shy person to come in front of the camera on a podcast. I'm a person who's just behind the scene or doing one-to-one with our patients and their families, but it feels great. And especially on the occasion of spreading awareness about stroke is the need of the hour. And we all neurologists should come ahead and educate people
On this
topic,
stroke.
which is
Yeah,
so
because
important
we
and dear to
see
us.
this so frequently happening,
Yes.
right?
And secondly, the field of neurology, that's too dear to me. It's a rich, scientific, intelligent branch of medicine where, per se, the brain has a lot of diversity. If you think brain itself, thing, whatever we are, how we perceive things,
So
our
complex.
thoughts,
Yes.
our movements, everything is
Yes.
decided by our brain. And neurology is an art of understanding this brain. We as neurologists, we function more as detectives, trying to decode symptoms, localize lesions where the whole system involvement may be at the level of peripheral nerves or spinal cord, or in the brain, which area. As you know, multiple areas of the brain dictate what
Multiple
symptom and
things.
signs are
Yes.
going to come up.
Yes.
So it's challenging. Plus, we also deal with a lot of humanity issues, breaking
Yes.
out life-changing diagnosis to people and the
Yes.
family. And but we do it with compassion, with dignity, and that's it.
So that all explains about why you are so compassionate
Of
about this
course,
entire
of
thing.
course. And neurology, there is lifelong learning in neurology. You'll never be expert in neurology at all. It's just about learning. The brain is adapting, learning new things. It's a never-ending journey.
Beautiful, sir. So we'll start with stroke as
Yes.
the topic of the podcast is. So let's start with something which is we have heard there's ischemic stroke, hemorrhagic stroke, and then there is TIA, which is transient ischemic attack.
Yeah.
So tell us about it. What are these?
Yeah. So, to put in short, stroke is brain attack. Nothing short of a brain attack. As people are very aware about heart attack, people are not so aware about stroke, and that it is a brain attack. That's the reason the contact with the healthcare team is a little later. That's why these awareness should be there. Stroke comprises of sudden onset focal deficit. The early signs may be you'll start suddenly losing balance. That is B for balance. E is if you lose eyesight suddenly. If you're if
Blurry
the whole
vision or
eye
something like that.
becomes blind, or either side you can see half of the world, half of the field.
Okay.
That's a sign of stroke.
Stroke.
Other thing is F is for face. If you have
Face.
sudden face drooping or drooling from mouth. If A is for arm, if you have sudden arm or leg weakness, or if you have sudden speech, S is for speech,
Slurring of speech,
slurring of
which we
speech,
take.
or
Yes.
language difficulty, or
Acha.
difficulty in comprehending
Okay.
things.
Okay.
You may be suffering from stroke. This is the acronym Be Fast, and the
Okay.
last T is for time. Timely go to a stroke enabled center. Because time is brain.
Yeah. Time is the most important factor when it comes to the stroke treatment.
Yeah,
right?
acute stroke management.
Yes.
That's the most important thing.
Yes.
Coming to types,
Yes.
Tushita, there are two types basically: ischemic stroke and hemorrhagic stroke.
Yes.
So ischemic stroke is by far the most commonest stroke, wherein 85% people have this.
Ischemic stroke is the most common
one. Here, the symptoms are because blood supply to the brain or part of brain is hampered. Usually, there's a clot in the blood vessels which supply to the brain, which hampers the blood supply. Normally, if the clot is within the brain, it's called as thrombus. And if it is coming out outside the brain, for example, carotid arteries, from artery to artery, or from the heart to artery, it's called as an embolism. So, consequently, the treatment also changes for the same. Why clots form is because of plaques as you age. If you have diabetes, if your lifestyle is not good, your cholesterol levels are high. With aging, also there are plaques within the artery. The arterial walls start having plaques. These keep on building up. Suddenly, when one plaque ruptures, the blood that is gushing through the area starts forming a clot, and this clot can go up and dislodge and go up and cause the symptoms of stroke.
Yes.
So this is about
ischemic stroke. Yes.
Ischemic. About hemorrhagic stroke. Hemorrhagic stroke is because of any bleeding in the brain. There are three types. It can be intracerebral bleed, which happens because of uncontrolled hypertension. The brain parenchyma, there's a blood patch in it. Others are subarachnoid hemorrhage, which is between the envelopes of the brain. Usually there's some aneurysm, some ballooning of the blood vessels which rupture, and subdural hematoma, which is underlying the skull, which is usually post-traumatic.
Acha. So what is this TIA?
TIA are mini strokes, and people should be aware of our TIA.
Acha.
TIAs are transient ischemic
Ischemic
attack.
attacks.
So there is no damage as yet to be that has occurred to the brain, but this is a forerunner of stroke.
So it can be said as warning sign before
Yes,
a
warning
stroke.
sign, and it's a red signal. Such people can have a stroke within next 48 hours.
couple of
The
hours,
risk
yes.
comes down after 3 weeks, but still they have to be vigilant of getting a stroke.
Of getting a stroke. Yeah. So one word which we have heard very frequently when it comes to stroke management is the golden hour.
Yeah.
So precisely how many hours is this, and why is it so important?
Yeah, good question. So golden hour, see, brain is the most oxygen sensitive organ in our
of
body.
the body, yes.
Whenever there is the blood supply is hampered, you get devastated results because brain cells are not forgiving. Every minute, 2 million brain cells start dying if they're deprived of blood, if the oxygen supply is deprived.
Okay, ma'am.
So the more earlier you act, the better chances of
Reviving
preserving
that.
the brain,
Acha.
preventing the insult from progressing. So there comes the golden hour. Now, within first 3 hours to 4.5 hours, there are chances we can lyse the patient, give thrombolysis, or do a stenting of the brain arteries and remove the clot. So this helps in preventing the further damage. There's a concept called as ischemia, infarct, ischemia, and the penumbra.
Acha.
So what occurs is, suppose there's a blood vessel which is blocked, and further the blood supply to the brain, we know this artery is going to supply this part, and it has just started. One part is necrosed, it's completely died off. The other part is still at risk because the artery is closed down. So we know this part, that is the penumbra, ischemic penumbra. So restoring earlier the blood supply there will prevent the stroke from increasing. The ischemic penumbra, the area surrounding, will be salvaged, and this is the whole mechanism why stroke needs to be treated within golden hour period,
and the importance of the golden hour in general.
Definitely.
So as you just mentioned that people don't realize or don't recognize the early signs. So if I may ask you, tell us a few warning signs before a stroke really hits you, and how many hours before the actual attack, what would be the signs?
Yeah, the signs can come anytime to anyone, mind you, from children to a old adulthood. Anyone can be stricken with stroke. The signs are, like I told you, be fast. Remember the acronym be fast.
Be fast.
Sudden balance, loss of balance, vision loss. Now in vision loss, again, many people, they go to, I've lost this vision suddenly, and they'll be going to an ophthalmologist. If it's Sunday, the ophthalmologist OPD will not be there, and there is the whole day, and then the ophthalmologist will refer to a neurologist. No, there's sudden blindness, go to a neurologist. This is stroke.
So that's how it gets very delayed.
And then it gets delayed. So people don't understand even sudden vision loss. If you are becoming blind suddenly,
can be a red flag.
It is a red flag and stroke symptom. So all stroke symptoms are very dramatic. Face transient face deviation or speech, language. Suddenly, if you're losing unconsciousness, or even subtle memory disturbances, which are new.
Acha.
Or you can't navigate paths if they are new, sudden. This could be symptoms of stroke. You should act.
So, sir, just now you said that strokes can happen to anyone at any moment. So here we are talking about strokes in young individuals, basically. So what's the youngest age group you have seen strokes being affected?
So right from pediatrics, the causes may be different. As in pediatrics, young children also have stroke. The causes in young children are different. They may have sickle cell anemia. That's a form of anemia where red blood cells start sickling, and other causes could be congenital heart anomalies. But in teenagers and young adults, less than 45, the risk is same. The risk factors are similar as an older generation, because early atherosclerosis is setting in our young people nowadays because of our physical inactivity.
Do you think stress is also a reason?
Stress, because of stressful living, people don't exercise much.
Correct.
Life has become so competitive. Everyone is just running around. They're not spending good time on their physical activity.
Correct.
So the healthy junk food options are more to teenagers. If you are stressful, you will be eating more junk.
Yeah.
Healthy
Fast
foods
lifestyle,
will be, fast
basically.
lifestyle is a major risk factor for young people. Another issue is drug addictions, as in drugs, smoking. Smoking in young predisposes to early stroke. Addictions as in heroin, cocaine, amphetamines. These also rising up in our college-going people. In females, when there is intake of oral contraceptive pills nowadays, since the obesity epidemic is going on, people have PCODs. To regulate their menses, young females are on oral contraceptive pills, so they are at high risk of getting a stroke. Other thing is, if you smoke and have oral contraceptive pills, the risk is many more times,
multifold increased.
So these are the predisposers for young people.
So, sir, a little naive question, but I'll still ask. We have seen some cases of stroke who have had a massive stroke attack, but comparatively, recovered quite well. But few of them who had a very mild or maybe symptomatically very mild stroke, but are suffering longer. Why is stroke so unpredictable?
Yeah, nice question, and I would like my audience to know this, because this is practical difficulty for us also, explaining our patients and the caregiver,
because not every stroke is same.
Yeah, that's why. So not every stroke is same. Each individual is different. People come, no, this one relative of mine had stroke. He improved very fast. Our patient is not improving.
ये क्यों नहीं हो रहा है?
ये क्यों नहीं हो रहा है? ये फलाना फलाना इनके पास गया था, पैरालिसिस सेंटर में गया था, some quack doctors, and उनका अच्छा हुआ है. This is the reason in India many quack doctors are taking this opportunity and treating stroke. But finally, it's I'll tell you the mechanism what really helps in knowing which recover later. So first is type of stroke. If you have an ischemic stroke, जहाँ पे blood supply कम होता है, उनको recovery के chances ज्यादा अच्छे होते हैं. Hemorrhagic stroke में क्या हो जाता है कि already blood अंदर brain में होने की वजह से, bleed होने की वजह से, there's some scarring in the brain tissue. It will leave some residual dysfunction. Another is the location and size of the stroke. So if the size is small, lacunar stroke, if it is subcortical, they have little better chances of improving, and they improve quite nicely. If the site, for example, if the strokes are in a motor language area or motor function area or brainstem where critical functions are there, such strokes are going to be a little disabling. It's going to take longer to recover. And the most important thing is time to treatment. People who have taken thrombolysis come to a stroke ready or stroke enabled hospital at the earliest, and timely reperfusion of the arteries determine the prognosis. So they do well. In fact, we see people coming with complete disability and improved and going back home walking after thrombolysis. Another thing is there's a resilient brain, and individual recovery is individual type. So what happens is, suppose if your blood vessel is blocked, the other blood vessels, they tend to take over that task. So they are called as collaterals. And collaterals, or you can also say them as backup blood flow paths. One blood flow is blocked, the other backup blood flow paths are good. In young individuals that happens. So in such persons also the recovery is good. Another concept is neuronal plasticity. No?
Okay.
Brain itself is molding. The moment we speak, the moment we do some task, it keeps on molding itself. That's the way of learning. So in
Okay.
childhood, you remember, we learn very quickly
Correct.
because our brain molds very fastly.
Correct.
The more we age, the
The
molding is
learning
not
process also gets
so good.
slower.
So this neuronal plasticity per se happens in every brain.
Acha.
A brain doesn't the cells once damaged do not reform again.
Acha.
But the brain works through synapses and through circuits. So the same cell will form new synapses. They'll form multiple synapses. The part where the damage has occurred, the surrounding parts also start taking that work. So that's where recovery starts taking in. And that's the reason many quack doctors, anyways, stroke is going to improve. So people go to quacks and they find improvement with that.
So that's the whole story about why some people, recover very fast.
Yeah,
But sir, also we have heard a lot about the rehab part
yeah,
post stroke,
yeah,
right?
yeah,
So many people they tend to discontinue. After a certain period of time, because the stroke itself is so emotionally and mentally draining, and
yeah,
it kind of leaves them very helpless.
yeah,
So the stroke rehabilitation, what message do you have for?
yeah. Stroke rehabilitation does help in recovery. Does help. It is proven. There could be physical therapy. There could be speech therapy, language
Because
therapy,
you learn
swallowing
everything
therapy.
new
Yes,
again.
yeah. You
Yeah.
are trained to learn it again. And
Yes.
like I told you, brain is moldable. The more
Huh.
you mold it, the more challenge you give it. Give a good supportive
Stimulations and all that.
stimulations, supportive environment, and it picks up.
Yes.
Other thing is with rehab, occupational therapy also helps getting back to work. How you can drink, eat. So these things all matter.
So, sir, when it comes to stroke management, right, we have now a lot of things which has come up as a part of AI, portable stroke management care, and so on. So, what are your thoughts on
Yeah,
these?
AI is here to rule, and it won't replace doctors, but
Thank God.
but it's a great tool, and is helping patient care. In stroke, we at our hospital also we have rapid AI algorithms where the AI tools in CT or MRI, they quickly diagnose stroke. When the manpower, it doesn't require much manpower, it quickly diagnoses. There are auto alerts for us in neurology. The moment a stroke patient sets in a campus, we get auto alerts, and we are on our tiptoes running to the casualty for the stroke patient.
So, it's
Second,
definitely improvised health.
yes, it is improvising healthcare. Second thing is stroke prediction models are there. AI-based models are there. People
Acha.
can feed in their age, their gender, their body mass index,
Acha.
their cholesterol, BP levels, and they will
Various
know
parameters.
how of next stroke risk, how much they will be
How they are
having.
prone to
Yeah.
having a
Uh,
stroke.
and for
Correct.
rehabilitation, particularly, AI is helping in sensory and motor feedbacks. So what
Acha.
happens is people get to know their own progress, how they are, and the program will be altered as per the patient's program, as per your need. So it's
Acha.
become more need based, and it's become very nice. Technology has evolved the rehab this with,
Aspect.
aspect with AI. Another thing is AI. AI also is coming a big way for a brain computer interference. People
Acha.
who are disabled completely.
Uh-huh.
Now they can, their brain signals can be decoded with AI,
Acha.
and it can be used to move a robotic arm, or
Okay.
move a cursor
That
through the
advanced.
computer. Yeah,
Okay.
even speech.
Acha.
So you can't speak, but your signals will be picked up by the computer, by the AI,
Uh-huh.
and through interference, the computer will speak for you.
Oh, that's great. So, sir, that's about stroke. So, we have another section which is the new segment, which is Mythbusters.
Okay.
And I'm very sure I have around 9 Mythbusters here with me. And I'm very sure every Mythbuster that I'm going to read out, you will be like, these are so common. So let's bust some myth.
Okay.
Okay. First myth. If symptoms go away quickly, it's not a stroke. Myth or a fact?
Myth. It could be a TI though, so be aware. It's again not so easy to just dismiss it. It's not stroke and just relax.
But it could
be
be
a
a TI.
TI.
So better get it checked.
Yeah, better get it checked.
Strokes are always dramatic, collapsing, facial droops, and paralysis.
Myth. It can be non-dramatic. There are silent strokes also. You know about silent stroke?
No. Please tell us. Something that I missed. Okay.
Silent stroke. People will not pick it up. Sudden little memory, I used to do this, and then suddenly I this, and then they'll neglect it. Many times silent strokes are people come late because no, it could be just fatigue. It could be just they have imbalance, and they'll think I had a peg of alcohol, and it could be because of that. So intoxication again. So these are causes of silent stroke, where you have a stroke and you don't realize it.
So that's about silent stroke. Okay. Aspirin helps during all strokes.
Myth. There are if it's cardioembolic, if the origin is from the heart, if you have some abnormal heart rhythm or heart walls are abnormal, we give anticoagulant that are more blood thinner wise. They
So aspirin is not for all
it
strokes.
is in general for most strokes,
Okay.
but not for all.
Not for all. Okay. A mini stroke, which is TIA, is a major warning.
Yes.
We just spoke about that.
Yes, we just spoke.
A slurred speech is one of the earliest red flags.
It's a myth. There could be other signs we just spoke. Be fast, along with slurred speech. Could be any other things also.
Yeah. Women are more likely to die of a stroke than men. Please say it's a myth. Please say it's a myth.
No, it's a fact.
Oh my God.
Women live longer.
But
Women
stroke,
live longer,
stroke
so they have high chances of getting a stroke and mortality. Dying women more frequently died from stroke than men.
Okay.
Men get it early though because of smoking and all, but women get it later, but they are
the mortality rate is higher. Okay. Stroke can happen without any pain.
Yes, stroke is painless, and that's the reason they don't come to us. You imagine people having left hand weakness. Few of my colleagues, radiologists, whose father had a stroke Sunday, and they think, no, my left hand is not working. It must be cardiac issue. Because लोगों को पता है left heart or heart. They'll wait for the cardiologist to see, and then the 4 golden hour goes by then.
Correct. So strokes can happen without a pain. That's a fact. Okay. Strokes can happen even if your blood pressure was normal yesterday.
Yes, fact.
Okay. 1 in 4 stroke survivors will have another stroke.
Fact, and very important fact. This we used to even American Stroke Association uses this to warn people: if you've had a stroke, mend your lifestyle. There's a 1 in 4 chance of getting a very disabled stroke again in life.
Okay, so some quick questions: stroke or seizures, which is harder to spot quickly?
Okay, so this is a rapid fire.
Rapid fire. Strokes or seizures, which is harder to spot quickly?
Stroke is harder. Seizure is very dramatic, so people anyways come if unless it's some focal seizure or absence seizure in childhood. But stroke is
more easy to spot. Okay. Aspirin during stroke or wait for doctor?
Wait for doctors. There could be different type of strokes. Aspirin is used to prevent stroke. So it's not useful to treat the stroke. Treatment is with thrombolysis, where you open the artery with injections, or do a thrombectomy, where you remove the clot.
Older adult or young professionals, who do you see more strokes in lately?
Okay, that's a tough one. Older adults still, but the proportion in younger is rising, like we discussed. But older adults, yes.
Meditation or walking? better for stroke prevention?
Another uh, walking. It is walking is more beneficial. Scientifically, it is proven walking reduces your blood pressure. At least 35 minutes per day you should walk, and it reduces the risk by 27%. Walking has other lifestyle importance also. It reduces the weight, obesity, or cholesterol levels. Meditation is useful as an adjunct. Meditation is more useful in decreasing our stress levels.
Stress
It
levels.
can marginally decrease our heart rate and BP, but the effect is not so much as blood pressure. Another thing is meditation is useful, very useful for people who are emotionally unstable or mentally. It gives mental stability. To quit smoking,
Concentration and
to quit
focus.
smoking, meditation helps.
Okay. Are you ready for the next one? It's a tricky one. Genetics or lifestyle, which plays a bigger role in stroke today?
It's getting more and more complicated and tricky.
Genetics or lifestyle?
Lifestyle.
Lifestyle.
See, genetics, you may be prone to have a stroke. Genetics, having a gene and susceptibility is not everything.
Acha.
The gene needs to be expressed in an environment, be it for any genetic disorder. You have to have that environment for it to be expressed. So lifestyle plays a major role. If you have to pick between those two, lifestyle we can't change our genetics, but lifestyle we can change, can be modified.
Yes. So CT scan or MRI? First test in emergency stroke
First
care.
test, definitely CT.
Definitely.
Faster, easier.
Blood pressure or cholesterol, which is the biggest silent threat? I have good questions for you, I think. So tell me, blood pressure or cholesterol?
You're really going to get me in trouble. Blood pressure it is, and it's proven.
Okay.
BP, getting a blood pressure under control will go long way in preventing stroke, any cardiovascular. That doesn't mean don't exercise, don't eat junk food.
Yeah. Moving on to the next one. One thing patients say that always makes you smile.
Oh, that's a really tough one.
Okay, let me simplify that for you. Share some story which is very close to your heart.
Okay. The first one, what if someone says, doctor, you really understand my problem, that brings a smile on my face. Because see, our patients come with very subjective symptoms. You have numbness, you can't quantify the numbness. They'll be saying, I have brain fog. Who knows what is really brain fog? You can't demonstrate it.
Correct.
So, understanding them, making them felt heard, heals them more. So this is a good compliment.
That
and then
you get.
Yeah.
And
Another one is when everyone lost hope in me. I know, doctor, you were the one who still kept trying.
Wow. That's quite heartwarming. Share some patient story which has left a deep memory in your heart.
There have been many.
Share one.
Story that's close to me. It's a stroke patient, a very young child. And the reason it's close to me is because it was a very odd type of stroke. Why it was caused. A father was just chipping a nail, and with a nail, हथौड़ी से वो nail को ऐसा मार रहा था.
अच्छा.
And उसका metal का टुकड़ा उड़ के neck पे गया. तो बच्चे के. And then the father tried compressing it, and the blood stopped. And they were okay. After a few hours, the boy developed stroke. They went to a nearby hospital, and the CT was done.
How old was this boy?
He was around 10-12 years. And CT showed some metal in the brain. And it was shocking how the metal entered from here and went up to the brain, and how we tackled it. And touch wood, the patient is good. He still sends his greeting every year. He's doing
so
great.
Very close to your heart.
Yeah.
So if not a neurologist, what you would have been?
I would have been an artist, some creator. I can paint. I love painting.
So there are some secret talents.
Yeah, everyone has.
Oh my God. Beautiful. What do you do after a long tiring day?
After a long time, nothing. I just like to sleep. Nothing.
Sone
Even
do.
if it is not a tiring day, I love sleeping and taking my sleep.
Okay, that's nice too, because I think many of us are very sleep deprived also.
Yeah.
So it's a good
But
message coming
sleeping
out
more.
from the
Yeah.
neurologist. If you get some time, get it, complete your sleep.
Yeah, but don't take more, because sleeping more also predisposes to stroke.
Oh my God.
Uh,
Okay. Okay.
More than 9 hours, if you're always sleeping,
Predisposing to
it
stroke.
it is a risk factor for stroke.
Okay, keeping that in mind and keeping all the points that we discussed, we will wind up today's podcast. Thank you once again
Thank
for
you.
coming on this platform. And, we spoke so much about stroke today, hoping that this message reaches out to somebody who needs it. And thank you once again for all your time, sir. It was a pleasure having you.
Thank
today.
you, Tushita. It's pleasure's all mine. Thank you so much.
Thank you,
The
sir.
only message: act fast. If it's a stroke, save yourself and your loved ones. Go to the nearest stroke enable center if you have any stroke symptoms.
Sure. Noted. Signing off. Thank you.